The time is 7:41 a.m. Good morning. The news headline: Delta variant. Oyetola implores FRSC to enforce COVID-19 protocols. Osun State Governor Mr. Adegboyega Oyetola on Thursday implored Osun State Command of the Federal Road Safety Corps to enforce COVID-19 protocols among commuters in the state to prevent the spread of the disease. Governor Oyetola spoke in Osogbo at the inauguration of the State Road Safety Advisory Council, a group charged with the responsibility to reduce incessant crashes on the road. Oyetola, who also represented by his Deputy Governor Benedict Alabi at the event, explained that road transportation system remains one of the potent sources of contracting the virus. He further said curbing the spread of the menace could hugely depend on the observance of COVID-19 protocols among passengers and road users alike. According to him, the current administration has continued to give road infrastructure its deserved attention, having rehabilitated and constructed several roads across the state since assumption of office, and tasked the Advisory Council to carry out its duty efficiently to guarantee safety of lives and property of citizenry in the state. He said, as a state that has given road infrastructure its deserved attention, having rehabilitated and constructed several roads across the state since coming into office, we are resolved to complement this gesture by ensuring sanity on our roads so that our road infrastructure program will perform its role as a socio-economic booster. I would therefore like to take this opportunity to implore the Road Safety Corps to enforce COVID-19 protocols, especially at this time when the deadly Delta variant has assumed a more virulent and fatal dimension. This is the time to put above pecuniary considerations. The 10-man Advisory Council, as the state Deputy Governor Benedict Alabi as the chairman, the State Commissioner for Works and Transport, Health, Justice, Education, Finance and Environment. Others are the representatives of the State Planning Commission and Nigeria Society of Engineers, while the State Sector Commander of the Federal Road Safety Corps will serve as Secretary of the Council. And the news analysis is quite simple, that we all know that the Delta variant is more deadly than the COVID-19 itself, and Governor Oyetola of Osogbo State at an inauguration of the State Road Safety Advisory Council actually charged the FRSC to reduce, FRSC are known to be those ones that are responsible to reduce incessant crashes on the roads, and they have told them that they should help enforce COVID-19 protocols and also the Delta variant protocols so that the spread of the disease can be reduced or perhaps stopped. Because with the seeming apathy on the part of Nigerians in the face of the third wave of COVID-19 and the Delta variant, which medical authorities have said is much more contagious and even virulent than the previous ones, Nigerians medical professionals have cautioned against the adopting a relaxed attitude which is capable of increasing the spread and compromising citizens' safety. And they said that the best way to curb the spread and danger it poses still remains going for the jab and observing such preventive measures as social distancing, regular washing of hands, wearing of nose masks, and many others. One Dr. Modupe Akinyika, who happens to be a senior lecturer and consultant public health physician at the Department of Community Health and Primary Health Center, Lagos State College of Medicine, Lasukun, said that it is imperative that everyone does the needful in this regard, which is guarantee the citizens' well-being. And to achieve this, Madam Akinyika said that hospitals need to ensure that social distancing is in place and observed while workers attend to patients. She said that the third wave of COVID-19 and Delta variant pandemics, that we cannot afford to have people with different health conditions congregating as was done in the past, and this is because just one person can transmit the disease to many vulnerable people who will then convey it home and spread it further. Accordingly, hospitals need to put in place standard operating procedures. Health workers should be trained and restrained on this to ensure they can identify suspected cases of COVID-19 and Delta variant when the patients show up. And hospitals should also ensure a steady supply of required protective equipment for the staff. She explained that hospitals should do due diligence in enforcing infection prevention practices to protect health workers and their patients, and also health workers must adhere to universal safety precautions and specific guidelines in relation to COVID-19 and Delta variants to avoid transmission to them. They are our soldiers in this war against the viruses, and we need them to stay healthy and not also to infect their families, she said. And also a public health practitioner and health promotion specialist who is Dr. Obina Ibirim, said that the safety protocol that was observed during the first and the second waves is still relevant, and if needed and at the appropriate time. However, the government should apply wider measures such as international or intra lockdowns, he said. In his view, the government should continue strengthening outbreak response. He said there is no need to train our human resources for health, and that there is need to train our human resources for health on outbreak and pandemic response, as well as to invest more in research, innovation, and development to be able to develop vaccines and such preventive tools such as face masks, hand sanitizers, ventilators, among others. For instance, he said we have done well so far and we can do better, and that Nigerians should try to take the vaccine so that they can have some level of immunity such that the impact is reduced if infected, and we can achieve herd immunity soonest. And as a result of all these advices from the medical practitioners about the government seeing to investing in research, and also that the health sector being so cautious, the Osun State governor is actually talking to the Federal Road Service Corps too, that as well as the hospitals are doing that and the health workers and all those and the federal government are doing their own part,